So in conclusion, Switzerland is a main biotech cluster in the center of Europe. The country comprises top companies in the pharma, biotech, and medtech industries. Switzerland has a high density of high-class universities, and this is certainly extremely important. There has been 16 public drug development biotech companies as of 2007 in Switzerland. The next slide is to me extremely important. Switzerland is considered as the homeland of high quality research. If you look very, very carefully at this slide, where you have on the horizontal axis what is called the wealth intensity, and on the vertical axis what is called the citation intensity. Now, it is comparing academic and scientific wealth, which means that the national science citation intensity, that is measured as the ratio of the citations to all papers to the national GDP, shown as a function of the national wealth intensity, or if you like, the GDP per person for the 31 nations in the comparator group. GDP and wealth intensity are given in thousands of US dollars at 1995 purchasing power parity. And as you can see, the source is actually the ISI, the OECD, and the World Bank. And as you can see, Switzerland is really at the top, at the very, very top, as you can see on the very upper top notch of the slide. And this is certainly what explains for the success of Switzerland in innovation. And that will conclude my second part, the second part of my talk. I think that if I have a take-home message, is certainly that Switzerland is so unique, speaking of innovation, probably because this is the homeland of high-quality research, and the amount of resources that is actually established and given to institutions as to compare to the number of research people is certainly extremely, extremely important. Let me now address the third part of my talk. I'm sorry this slide is in French, but it means Eureka, you know about it. I have an ID. I want to protect my ID. I want to publish, but as you know, publish or perish. I want to develop a patent. I want to protect my innovation. I want to find partners. I need help. I need a business plan. I need experts, and so on and so on. This is what happened at our own university hospitals and Faculty of Medicine. So let's talk about Innovation Office at the University of Geneva Hospitals. That's what we developed over the past 6 years in our institution. What is it? Let me summarize for you 3 years of innovation summarized over the past 3 years between October 2009 and let's say June of 2012, speaking of the Hugh Innovation Office. The mission statements of this office is, or are, to promote the innovation mindset among the collaborators of the institution, to actually have in-house, directly accessible office for innovators at the center of a network of professionals to foster innovation projects. The promotion of innovation has 3 major objectives: enhance individual and collective creativity, increase awareness of intellectual property, develop new tools, and improve patient management and staff and patient safety. Promotion of innovation has been turned into actions, and there are many actions that what we are doing. First of all, we have an annual Innovation Day that John referred to at the very beginning, and this is actually what you are doing now in Calgary. I will come back on this Innovation Day at the end of my talk. Then we have an internet website. We have regular publications about innovation in international journals. We have courses and seminars during medical training, so-called clinical research, teaching of innovation. And we have what we call our monthly innovation cafes, where people are meeting together to share and discuss about project in innovation and innovation technology. The procedures that we have is that we have one single contact to facilitate the implementation of innovation projects at our institution. We have standardized innovation procedures, and that was extremely important at our institution too. The actions were setting up of standard operating procedures for each innovation step by step using a very standardized way of doing it. We have established a very strong network, tech transfer professionals, innovation transfer and program and patent professionals, experts in ethics, in medical devices, in medical techniques, and so on, incubators, and economic affairs. And of course, the law department of our institution, they are all invested in the discussion about innovation at our institution. Let's now look at the results of our strategy between 2009, let's say October 2009 and June 2012. We have had around 100 innovation projects that have been handled by the innovation desk or the innovation office. We have had invention disclosures. We got advice from experts. We got collaboration contracts. We got mandates. We got administrative support, or we got financial supports, and all of these was necessary in order to make a good promotion of the strategy, a good promotion of our system, so that innovators get sustained and get actually helped to move forward with their innovation. The results is in terms of increased number of patents that have been described at Hugh, for a total of 35 innovations that have been selected. Sorry, the top of the slide is in French. These are the statistics of the cases that are the cases developed at Hugh that were actually selected and then were the object of registered patents and then the object of registered licenses between 2009 and 2011. The results speaking as the increased number of startups that have been funded over the past almost 3 years by at least one Hugh collaborator. You see the list of the different startups that are in the field of diagnostics, medical devices, biomedical research, pharma, or software. So you can see a lot of different startups that have been constructed and that have been developed since and from the beginning of our program. In conclusion, we have developed a solid know-how in innovation management. We have increased the number of innovations. We have innovations from all fields of medical research or medical practice or clinical practice or medical management. We have increased the number of patents, licenses, startups, and small companies, and it has been very, very stimulating, in a very stimulating atmosphere at our institution. But last but not least, I will give you a few slides about our Innovation Day, which is the one day during the year where everybody is coming in order to celebrate innovation at our institution. It is not enough, but it is at least one day during the year where we celebrate innovation and where people are coming. This year we will celebrate our 6th Innovation Day. It will be on Thursday, sorry it's in French, but it's very easy to understand, on Thursday the 11th of October 2012 at the University of Geneva Hospitals. During this day, people are promoting and are actually submitting projects. The way they are submitting projects is that they are sending abstracts. They send abstracts 2 weeks in advance. We have a jury that is looking at the abstracts, judging the abstracts, selecting the abstracts. And then, of course, we have a process so that after we have reviewed the abstracts, we move forward. And the best abstracts are the topics and selected for what is called the Innovation Academy, a very, very popular endeavor at our institution. If you want to submit and go for the Innovation Academy, you submit your abstract. Then it is reviewed and selected by a jury. The jury is made of internal people interned to actually the University of Geneva hospitals and the Faculty of Medicine, and also from external people. They are coming from outside the institution to help. They are technology transfer experts. They are experts in innovation and development. Then, if you are selected, you have to come 2 weeks in advance to defend your project. Then, posters accepted are selected for abstracts presented in a poster. And then the 15 best projects get selected either for a pitch presentation where you have 3 minutes to present your project or for the Innovation Academy Award where you have 10 minutes to present your project. And of course, if you win the Innovation Academy Award, here is what is for you. Here is the Innovation Academy Award, which is linked to 10,000 Swiss francs. That is not for you to go and have a drink, but is for you to actually start and move forward with your innovation. So, this is the way we have conceived innovation at the University of Geneva Hospitals and Faculty of Medicine. I'm perfectly conscious that we are at the beginning of the huge innovation valley, but this is a beginning, and I wish you good luck in Calgary at promoting innovation, which is so important for your institution, your academy, and also, of course, for your patients who will ultimately benefit from that. And for those who are interested, of course, we have developed this WHO Collaborating Center on Patient Safety, which is a center that is working for the World Health Organization at recognizing the importance of patient safety and promoting for major change in patient safety. And we have also used this concept of innovation in patient safety and innovation in infection control, antimicrobial resistance stewardship during the meeting that we organize actually once every 2 years, and the next will be in 2013 in June, between the 25th and the 28th of June of 2013 in Geneva, Switzerland, and where we have also an innovation academy process that John knows very well, that was extremely successful last year, and that where we would like to promote the major change in practices in hospitals for the benefit of patients. With these, I would like to thank you very much for your attention. I would be more than happy to answer questions. I will see how John has handled and will handle the following part of the discussion. Thank you.